We are live now. With all your permission, ma'am, I am start.
Okay.
Ma'am, we are live now. With all your permission, I am starting this webinar for today, ma'am. There was network issue.
So anybody
Hello.
will introduce, right?
Yes, ma'am. I will introduce you and then I
Somebody.
will.
Okay. Okay.
Good evening, everyone present here. I am Faraz from ICP Group. Welcome all the participant on today's webinar. That is on a very important topic. That is behind the lump, decoding neck swellings, a case approach. And for this, we need someone who is expert and someone who can have a real experience with this problem. So I would like to welcome ma'am, Dr. Anita ma'am, and she is she has lots of experience in this field, and I would like to invite ma'am and hand over this webinar to ma'am. Before hand over to ma'am, I would like to share some of the achievement of ma'am. Ma'am has done MBBS, MD in radiotherapy oncology, radiation specialist oncologist and unit head of IOCI Fortis Hospital, Noida. So ma'am, I would like to invite and hand over this webinar to you. You can proceed from here. The stage is yours.
Okay. Thank you, Faraz, for a nice introduction.
We will
So
say next. I will.
today, yes, tell you the when to change the slide. So the topic of discussion today is neck lump or mass. So if someone presented with this problem to you, then what you should do? What things you should have in mind, and how to proceed further. So this we are going to discuss in this session. Next slide. So when we see the causes of neck lump, 80% adults uh, who are beyond the age of 40, most of them are like 80% of those patients, they have the possibility of malignancy. And in other way around, in young adults, the more common are benign reasons or other non-malignant reasons. And out of these all malignant cases, 30% are squamous cell carcinomas. And in majority of this, we are to find primary cause why this pregnancy is started, why this lump started, from where it started. Means in maximum cases, we get this, and in majority of the cases, the so this means that in elderly, cancer is common and squamous cell is common, majority cases, and we know from where it is originated. But still, there are few patients in whom which we are not able to identify that this is a neck node and where is the primary, from where it is originated. What is the primary cause? For us, I hope I am audible.
Yes, ma'am. In between, your voice is getting disconnected, ma'am. You can proceed.
Okay. S- So you can change the slide. Next slide. So we can do few things is somebody is having this problem, we should look the age. In younger patients can be infective or these things, and in elderly patients, there are chances that the patient has some kind of malignancy. And what is the duration of change of this lump? Has it or in next few years it say it is size is not increasing? So we can have like what exactly. And regarding the symptoms, patient may have pain sensation, abnormal sensation. There may be stexis, hemoptysis, dysphagia, hoarseness of voice. Patient may have some altered feel of cold or hot intolerance. I know this is common in the third cases. There can be palpitation or some. So there can be associated history of tobacco or alcohol consumption in such cases. So this indicates more like having a malignancy in such case, because in cancer patients, 70% patients they have this symptoms, and the major culprit is tobacco. So there are causes may rule out for the history that patient may have recent travel, there may be bite from any insect, there may be animal exposure, there can be history of previous malignancy for which the patient got treated, or there may be some family history of such kind of illness. Perhaps you can change the script. Next, please.
Ma'am, can you hear me? Hello.
Yes, yes.
Yes, ma'am. We are in the current this slide. Shall we move or keep it? Ma'am,
Okay.
your voice is
So,
breaking. Yeah.
yes. So, what we can do next?
I have changed the slide now. Next, we are at next. Ma'am, you are on mute. Yeah.
Slide before this,
Ma'am, your voice is breaking. Hello.
before this,
Yeah, before
previous.
this one. Yeah. Ma'am, you are muting yourself, ma'am. You are keep muting yourself. Please unmute. Yeah, now
Okay.
it's fine.
One more slide before this.
Okay, ma'am.
Okay. So, what we should do once the patient is there with you with a neck mass, so we should examine this carefully. Apart from neck mass, is there any other lump in the head and neck region? we should find out what is the primary origin from where it is originated. There can be primary in the larynx, in the tongue, in any of the area of head and neck. So in that case, the secondary neck enlargement can happen. So we should examine this area. Sometimes we need triple endoscopy to examine the nasopharynx, oral cavity, and the larynx. And in the deeper part, anesthesia may be required. And thoroughly, we should examine the skin, the thyroid, if there is any swelling, or the salivary glands are intact or not. Next, please. Next slide, please. Yes. Okay. So these are the various reasons uh, which can, uh, in these cases, the patient may present with a neck mass. So when talking about the neoplastic or cancerous causes, these are metastatic neck of unknown primary. So in such cases, we assume that there is some minor salivary gland has cancer, and it has involved the lymph nodes, nearby lymph node, and the node is enlarged. Others can be epidermoid carcinoma, melanoma, adenocarcinoma of head and neck cancer. There may be thyroid cancer, there may be lymphoma, salivary gland tumor, there can be lipoma, which is kind of benign tumor. There can be angiomas, carotid body tumor, or rhabdomyosarcoma, which is common in children's. So these are the malignant causes. There can be congenital causes, means these causes are the etiology is from right from the birth. So there can be sebaceous cyst. I will take one by one of these. The majority of the cases I will take in this. One by one, we will discuss this. There can be branchial cyst, thyroglossal cyst. There can be lymphangioma, hemangioma, dermoid cyst. There can be ectopic thyroid tissue, laryngocele, pharyngeal diverticulum, thymic cyst. These are congenital deformities. While the baby is developing and some tissue remain there, and that increases, and these remnant structures can present as the patient can present as lymph nodal mass. There can be inflammatory conditions like bacterial infection, viral infection, granulomatous tuberculosis, cat scratch disease, sarcoidosis, fungal, and these there are further other causes, inflammatory reasons in which the lymph node enlargement can happen. So these many reasons can happen. So we will take few common um, etiology cases in which the most common causes we will discuss in this class. Next slide. So the most common cause is the reactive lymph node. Means something has happened in the near vicinity, and the patient is having the enlarged node is there. This is the most common uh, cause. It can affect all the age groups, and majority of the cases the lymph node is tender, it is painful when you touch it, and uh, when you see carefully, examine, ask the patient, there is some history of bacterial infection or a viral illness like infectious mononucleosis or HIV. So these patients may have these symptoms, and usually these problems are self-limiting. Means without no treatment, these patients, the lymph node swelling will subside once the viral illness or the bacterial illness get cured. So there can be some injury to the surrounding areas in, and the nearby lymph nodes get enlarged. Again, a reactive cause. And this reactive lymph nodes can occur with certain medications. Like if the patient is taking some anti-seizure medications, malaria preventive drugs. So these drugs also causes reactive lymph node enlargement. The other uncommon causes are like there can be associated with respiratory infection, cold, cough, sore throat, and patient may have ear infection, dental caries. There can be skin problem like dandruff. So these situations also causes lymph node enlargement. Next slide. Next slide, please. So go back to the lymphoma. So talking about lymphoma, this is second most common cause, usually in young patients, and this is a symptom of systemic malignancy. Means lymphoma is a systemic disease, and it can present. The patient can present as a lymph nodal mass, maybe in neck or in anywhere other region like axilla or anywhere. But the head and neck one is the most commonest, and these lymph nodes are rubbery and these are painless, and patients may have B symptoms, and these symptoms are if the fever is more than 38-degree, and patient has night sweats, and if there is weight loss of more than 10% in very short duration, then in such cases one may think of having patient having lymphoma. And usually in 30 if the patient is less than 30 years of age, there can be chances of like 21% of malignancy, and but if it increases the age in elderly patients, it is it is 61%. It is 61%. Next slide, please. So another common is dermoid cyst. It is a benign cutaneous development anomaly that arises from entrapment of ectodermal elements along the line of embryonal closure. So what does that mean? When the baby is in the womb, and his or her organs are forming, in that case, the peripheral cells, they and the inner cells, mesenchymal cells, they are forming the organs, and uh, there is some cells are entrapped in those tissue, and that can cause dermoid cyst. It can occur anywhere in the body, but it is most common in just below the skin. And a related condition that is known as cystic teratoma that can happen. And this in this cyst, there can be a mature and immature, all the elements, and there can be a serum, bone, teeth, cartilage. This can happen within that cyst. So usually these are benign and which can be removed safely with surgery. So these are benign cysts if it is a like mature cyst. Next slide, please. So another common example is thyroid swelling. So the thyroid swelling is a medial gland which is situated in the lower part of our neck, and you can see the shape of the gland, and if it is enlarged, it can be enlarged in uniformly in all the throughout the lobe. It can be a unilateral swelling. It can be swelling in the both the lobes. So and the swelling can be benign or it can be malignant in the thyroid carcinoma. So if the gland become hyperactive or it becomes hypoactive, so the patient may not have this swelling. So because we might have seen many cases with thyroid disorder, but they don't have swelling. But if a patient has swelling in the skin, one may think of a thyroid, and it is more common in females than in males. And patient may have symptoms of hyperthyroid or hypothyroid or thyroid when there is no symptom of thyroid. And how you can see this swelling once the patient is while moving and upward, or patient swallowing, this you can move this seeing this moving this swelling. So uh, whenever the patient is swelling, you will see the moving swelling. So you can differentiate, you can diagnose this with a good ultrasound, and there is a grading system of thyroid that is known as thyroids. And in thyroids above 3, the needle test or a biopsy, this is recommended. And there are certain drugs and iodine therapy. If it is the gland is hyperactive, we can control this activity and the swelling will subside once the patient is get treated. So usually in hyperthyroid patients, the patients they have heat intolerance. There can be palpitation, there can be diarrhea, tremors, or proptosis. This can happen with these kind of hyperactive thyroid patients. These symptoms can happen. Next slide, please. So thyroglossal cyst. This is another like remnant of thyroglossal when the thyroid gland is descending from the base of the tongue, uh, and it comes to the thyroid area. A duct is adjoining that gland, and if it doesn't disintegrate and it remains there, it is visible as a thyroglossal duct. And if it enlarges, then it becomes a cyst. This is a congenital remnant, and during organogenesis, this remains there. And you can see this in young adults. It is painless, smooth swelling. It is midline and lie between base of tongue, hyoid bone, and isthmus in this region. And it is fibrous structure. Due to persistent this thyroglossal cyst, and while moving movement of tongue and protrusion or swelling, you can move this you can see that it is moving with the tongue protrusion and swallowing. It becomes painful and red swollen once get infected, otherwise it is not uh, it is not painful. Surgical removal is the treatment of choice, uh, and this is a kind of benign condition. Less than 1% of the cases they can develop malignancy in that. So in that case it will increase in size. The size of this will increase if the malignancy happens in this. Next slide, please. So in such cases, what investigations are recommended? Complete blood count, thyroid function test. CRP is chronic reactive proteins, which increases in the inflammatory conditions. And ultrasound, CT scan, or MRI, that is indicated according to the suspicion. And to prove this, biopsy or a needle test may be helpful. Next slide, please. So, the commonest cause in children is infective. So, patients in pediatric group, we can think about infection, and the most commonest infection is tuberculosis, and it many times it resolves once the treatment is started. And in adults, it is commonest as malignancy. So in those cases, FNAC cytology is a diagnostic tool. Like even if it is tuberculosis, you may find a granulomas or tubercular granulomas in the slides, and pathologist will confirm, like, look, this is tuberculosis. So, in conclusion, if the patient has a lump, that has to be investigated, that has to be clinically examined by a physician to rule out the cause. Do not just sit back and it will not going to resolve itself. And You have to investigate it properly so that it will not come up with a bigger problem in future. Thank you so much. I can take questions now.
Thank you, ma'am, for taking out your important time and sharing your knowledge on this topic. I definitely think this session knowledge is going to help all the participants on their practice too. We have received some questions. With all your permission, shall we take these questions one by one?
Yes, please.
First question is from Dr. Subramaniam. He is asking, how can one clinically differentiate between inflammatory and neoplastic neck swellings? Could you please share some insight on that?
Yeah, so usually inflammatory infective are associated with the symptoms like fever, chills. The patient has these swellings are usually painful, red, inflamed. So any of these symptoms may happen. The ESR will high, TLC is high in those cases. In malignant cases, there may be some primary, some cause. Sometimes it may be outside your neck, maybe thorax, lung cancer, suppose esophagus cancer, they may have swelling. But majority of case there may be some symptom in the neck region. Means if it is a laryngeal cancer, there may be change in the voice. There can be a difficulty in swallowing in the case of base of tongue cancer. So there may be associated symptom sign with that problem.
Thank you so much, ma'am, for sharing an insight on that question. I can see one more question. The question is, ma'am, how useful is fine needle aspiration cytology, that is FNSC? Could you please share some point on that?
Yeah. So fine needle aspiration is like with a needle, few cells are taken out from that node, and that is examined under the microscope. So it is a very useful tool to identify the exact nature of the cells. But it may not be helpful in the case of lymphoma, because in lymphoma, in total lymph node has to be removed and the thorough examination is required. But in majority of the cases, 99% cases, FNAC is enough to diagnose the etiology.
Thank you so much, ma'am, for answering this question. Dr. Subramaniam has written, thanks for answering my question. Wonderful case representation. I hope
Thank you.
he is very much happy. Ma'am, I can see no further questions. I hope you have done justice to this topic, ma'am. As there is no more question, with all your permission, shall we conclude this session for today?
Yes, please. Thank you so much
Yeah.
for calling me.
Welcome, ma'am. And we would like to see you in future also with different topic. Till then, take care of yourself. It was great honor to have you in our platform, ma'am. Thank you so much.